Welcome back. Call 0808-054-2233. Again, 0808-054-2233 if you have a question on epilepsy. You can also tweet at CTV_Mary A for your comments or your questions. We were talking about medical treatment and surgery. Now, let's first ask, because doctors prefer to be able to treat you without invasion, right? When there's medical treatment and you say there's response in most of the cases, does that mean that the person is free from seizures for life once they take these medications?
Okay, the goal of medical treatment, the goal of treatment for epilepsy is to reduce the frequency, number of seizures that an individual with epilepsy has.
Not to totally eliminate it.
Or, if possible, totally eliminate the seizures. Well, most patients with epilepsy will have to be on treatment for life. However, there are some epilepsies that do not continue for life. So that brings us to the concept of cure for epilepsy.
Okay.
So there are some epilepsies that are age-bound, like juvenile myoclonic epilepsy. After a particular age, the epilepsy stops, so the person becomes normal. After adolescence, no more seizures. Now, if somebody has taken anti-epileptics and is seizure-free for 10 years, the last 5 of these years, if the person has not been on medication, then we can safely say that the person has been cured of epilepsy. But most clinicians will look at somebody who has enjoyed seizure freedom for 2 years and say that the person is cured. But in the strictest sense of the word, it is 10 years of seizure freedom, the last 5 of which the person would have been off anti-seizure medication. So if the person has not convulsed for 10 years, and the last 5 of these years, the person has been off medication, we say the person has been cured of epilepsy.
When does such a person get to be allowed to drive, cross the road by himself, bathe in a tub, swim? When can they do this?
Well, so that's a little tricky, because in Nigeria, we do not have laws for epilepsy as regards driving. But in the UK, in the US, there are laws. So ideally, if somebody has been diagnosed of epilepsy, he's supposed to be reported to the driving license authority. And usually, if the person has been seizure-free in some climes for about a year or 2, he can now be allowed to drive again.
Okay.
Yes. So if the person, in a sense, has been cured of epilepsy, he can now drive again. But here, we do not have those kind of laws yet.
We have a phone call coming in. Hello. Hello, Emeka, are you there?
Yeah, I'm here. Good afternoon.
Good afternoon. What's your question?
I want to ask, is there anything like age limit concerning epilepsy?
Is there anything
like age limit concerning the epilepsy? Hello?
Did you hear? Yeah. Please, could we have that again?
Hello?
Hello, we can hear you.
I said, is there anything like age limit concerning epilepsy? Like somebody like this, at a certain age, like maybe 20, 30 or something age, I think will stop. Or does it mean that it can last maybe?
I'm not quite hearing him well.
Well, I didn't quite pick that. If it's not too much trouble, can you take the question again?
Please call again and do take that question. We both didn't hear you so well. Okay, he was asking about age limit, whether there's an age limit for epilepsy. But you just spoke about the juvenile type.
Yes. So there are some epilepsies that are age restricted. So after a particular age, they may cease to occur. But usually, most epilepsies are lifelong.
Lifelong.
Yes.
And are there some that they have to take medication all their lives?
Exactly. So most of the treatment for epilepsy is life.
How do you decide when to take somebody off medication?
Okay. So this is exactly the same thing I was trying to explain with the cure.
Okay.
Usually, most clinicians will start taking off someone, will take someone off anti-epileptic medication if the person has enjoyed seizure freedom for 2 years.
2 years. But 10 years is ideal.
Yes, but if the person has been seizure-free for, currently we are looking at somebody who is seizure-free for 5 years.
Okay.
And
Let's quickly take Ife's call. Just